Institut Jantung Negara marks another milestone for the advancement of cardiovascular care in Southeast Asia by performing the region's first ever Pulse Field Ablation procedures using the Medtronic Pulse Select system. This groundbreaking treatment represents a significant advancement in the options of treating of patients with atrial fibrillation. This region's pioneering procedures were successfully performed by IJN's leading cardiac specialists, Dato Azlan and Dr. Suraya. The innovative Pulse Select system sets a new standard in cardiac ablation safety. Unlike traditional ablation methods that use heat or cold energy, this approach employs precisely controlled electrical pulses to treat irregular heart rhythms.
So with atrial fibrillation, one of the potentially fatal complication is stroke. Because what happens in atrial fibrillation is because the top part of the heart is not pumping normally, blood clot can form inside it, and when that blood clot travels to the brain, that can cause stroke. And this is usually prevented by taking special blood thinners. And of course, there are other studies that shows that with reducing AF burden by medication or ablation like we did today, that can reduce long-term risk of stroke as well. So the technology that we use today is what we call Pulse Field Ablation. So this is a relatively new technology introduced after radiofrequency and cryoablation. So what is the difference is we use electrical pulses to induce cell death to make sure that the atrial fibrillation doesn't come back, compared to previously using heat or cold energy. So in terms of safety, this has been shown to be safe to be used and reduce a potential complication from procedure.
At the heart of the advancement is the procedure's combination of safety and efficiency. The procedure can be completed in a fraction of the time compared to conventional treatments, while offering enhanced protection for the patient's surrounding healthy tissue. This breakthrough brings new hope, particularly for those who may have had limited treatment options in the past.
So this is the second system using pulse field energy in the treatment of patients with atrial fibrillation. In IJN, we have used the first system, which was launched roughly about a year ago, and we have done about 200 over patients. So this is the second system from the company known as Medtronic. It is called the Pulse Select system, and this is the first procedure using the Pulse Select system in Southeast Asia. So IJN is extremely privileged and thankful to be given the opportunity to use Pulse Select from Medtronic in one of our patients who have paroxysmal atrial fibrillation. In terms of the energy used, though similar in effect to the first device that was used about a year ago. However, there are some difference in the parameters, and these technical parameters hopefully will lead to a better outcome in patients. The system, in terms of its usage and its ease of use for operators, are fairly easy to use, more or less similar to the first that we have used before. And we hope to do a few more of these patients, and we will follow up these patients and compare the outcomes so that Malaysians with atrial fibrillation will have a better option as far as the treatment of atrial fibrillation is concerned in our country.
Clinical trials have demonstrated the system's outstanding safety profile with a remarkably low 0.7% complication rate, one of the lowest in cardiac ablation procedures. This means patients can receive treatment with greater confidence and potentially return to their daily activities sooner. IJN stands out as a premier cardiac center by offering both the Medtronic Pulse Select and Boston Scientific's Farah Pulse systems for atrial fibrillation ablation procedure. The Farah Pulse system, on the other hand, features a specially designed catheter that can adjust its shape to reach different areas of the heart effectively, providing another safe and efficient treatment option. This dual capability allows IJN specialists to choose the most suitable approach based on each patient's unique needs and heart condition. As Institut Jantung Negara continues to lead the way in advanced cardiac care, this first in Southeast Asia achievement not only demonstrates Malaysia's position at the forefront of medical innovation, but also brings new hope to patients suffering from atrial fibrillation. This groundbreaking procedures reaffirms IJN's commitments to deliver world-class cardiac care and improving patient outcomes across the region.